Hope you're doing great today. Facts Ideas Tips is a platform created by me to help medical students about tips and tricks regarding surviving in med school. So subscribe if you find this interesting. In the first episode of the series How to Study in Med School, we are going to talk about how to study general surgery. This video is mainly for Indian medical students. However, other students can also find some aspects of this video helpful. Now, general surgery is one of the toughest subjects for many medical students out there, and that's probably one of the reasons why you are here now. Don't worry, in this video, I'm going to help you guys with some of the tips and tricks on how to study general surgery in an organized way. We're going to break down some of the minute hacks which will help you succeed in general surgery in med school. First, let's talk about theory exams. The books I'd suggest for theory exams are SRB's Manual of Surgery and Bailey and Love's Short Practice of Surgery. Now, SRB's Manual of Surgery is the main book which I used for studying for theory exams because it is properly organized in the same order for every topics as how we are going to write in theory exams. The second most important thing which you must know is to take proper notes during your surgery theory classes. After you reach home, make sure to revise the notes which you made on that day in your class, and along with the notes, read the same topic from SRB, so that will help you to reinforce all the things about the topic in your mind. The most important step will be being thorough in the past year questions in the previous university examinations in your college. This is because most of the times many past year questions from your previous university examinations of your college will be repeated exactly, and if you are thorough in those questions, you can write them very easily and you can score well. Make sure to write down the questions first as short questions, which are usually 5 marks or 6 marks, and long questions which are 10 marks. Whatever topic is being taught in your class, make sure to read the relevant past year questions from the checklist which you have made and make sure to tick them when you complete them. Every Sunday, make sure to refer to your class notes and the topics which you read in SRB that whole week and the past year questions which you have covered in that week. So the Sunday is mostly used for revision of whatever you have studied in the whole week. You might think that I told about Bailey and Love textbook of surgery, but I never spoke about it. It's obvious that there is no much of love for Bailey and Love textbook among most of the students out there. But if you ask me, I would say that it is one of the best books available out there for general surgery, and I used to be carrying it around most of the times when I was studying general surgery. The topics are given very precisely in very easily understandable language, and so much of extra unnecessary information which are given in other textbooks are cut down from this textbook, so this just gives you what you have to know from the undergraduate level. And at the end of every paragraph there is a cute summary which will help you to know the very important points as well as revise whatever you studied in that one paragraph. And apart from that, for a lot of the MCQ entrance examinations, questions are being taken from Bailey and Love. If you have the practice of reading Bailey and Love, you might find it easier to solve MCQs in competitive entrance examinations. If you're interested, I'll leave the link for Bailey and Love's textbook in the description. You can buy this book using the link if you're interested. Now about clinical postings, two things first. Top most important regarding clinical postings is go website and Manual of Clinical Surgery, which is by S. Das. Have this textbook as a reference for your clinical postings, and make sure to read this when you are in home or just before entering your clinical postings. If you have some short break, that's what I used to do usually after my theory classes. When I'm about to go to my clinical postings, I used to read whatever case we are going to take today. About that case I will read in this textbook. I will read about the aspects which are going to ask in clinical history as well as the examination points, so it will help me to have an idea of what we're going to do today. And then when we're going to go to the patient, it will help me to ask the relevant history as well as to perform the relevant clinical examination on the patients. So it is very important to try eliciting the clinical signs and strengthen the history taking skills by talking with the patients. If you are going in a group of 4 or 5, it will be helpful for many students to learn at the same time, instead of going one by one and asking the same question again and again to the patient and doing the same clinical sign again and again, which might make the patient irritable. Be kind to them, explain them that they are helping you to learn, and by doing so you are going to become better doctors and serve more people like them, which will in turn help them to cooperate well. And if you're really kind to them, they would not hesitate mostly to cooperate. These books are super bonuses, I would say, because there are certain things in each cases which needs your knowledge from pathology and other stuffs which you have read in your previous years of med school, but you might have forgotten them. These books will have the relevant points which will be asked in your viva examination after you have done presenting your clinical cases. What I used to do is that before taking a clinical case, I would read about the history taking and examination procedures from Yesda's textbook, and then I'll go and do the history taking and examination of the patient. And once I'm done noting it down on a paper before presenting it to the faculty, what I'll do is that I'll take this textbook, and there are separate textbooks by Raj Mahendran. One is for long cases in general surgery and the other is for short cases in general surgery. So whatever case which I'm taking, for example, if I'm taking a thyroid case, that is a long case, so I used to read this in long cases in general surgery. This will help me to be ready for the presentation which I'm going to do to the faculty, and this will help me to answer the questions which they're going to ask me about the case once I'm done presenting. So the links for these textbooks also will be provided in the description. Never be shy in case presentations. Have a close observation on the questions which the faculty asks during case presentation, and note down the list of questions which are asked by a particular faculty, and have a separate list of all the faculties in your college are asking the questions for various cases. Most of the times these faculty will ask the same questions even in your university exam case presentation vivas. So if you are making mistakes in these questions, they would really get pissed off. So make sure to have a close observation on the questions which your faculty are going to ask in your clinical postings, and make sure to be thorough with those questions. Present as many cases as possible whenever you get opportunities. Use that opportunity, take cases properly, study about the cases in the procedure which I told. So as a summary, I would say, first, before going to take a case, make sure you know about the procedure of the clinical examination findings which you're going to do from S. Das textbook of surgery, so that you do not embarrass the patient by reading one by one and demonstrating on the patient. And second step is write down the history and examination findings properly in proper format before presenting the case to the faculty. And third step is, while waiting for the faculty, if you have some time, what you can do is that you can read about that case in Raj Mahendra textbook. So relevant viva questions will be there, so you can have an idea of what will be probably asked about that case, which will help you to be more ready for the case presentation. You can check out my main channel, Med Vids Made Simple, and you can watch more videos from facts, ideas, and tips. Thank you so much for watching this video. I'll see you guys in my next video. Bye.